Hello, everyone, and thank you for joining us for this webinar looking at advocacy and PKU and what we hope to do in the new year. So my name is Christine Brown. I'm the Executive Director of the National PKU Alliance. So excited that you could join us here tonight. The NPKUA has been involved in advocacy almost since our founding. In 2009, we started working in the halls of Congress and talking to congressional staff about the dire need in the PKU community around the need for coverage and reimbursement of medical foods, including both the formula to treat PKU as well as low protein foods. And since then, we've continued to be involved very much so in this work, as well as in broader rare disease public policy. So I'm so excited tonight that we have some amazing speakers that are going to tell you a little bit about what we think we can expect here in 2021 with a new year, a new administration, a new Congress, still a pandemic, as well as a number of other political things happening that we are all aware of. So tonight we have Eric Gasco with us. He's the Vice President of Policy and Government Affairs at the National Health Council. He's been in that role since 2009. So what he does is Eric helps the National Health Council and its member organizations develop policy positions that seek to improve the lives of people with chronic diseases and disabilities, and advocates for these policies on Capitol Hill and within the executive branch. Prior to joining the National Health Council, Eric worked in the Government Relations Department of the Society of Teachers of Family Medicine. He earned his BA degrees in Government and Business Management from the University of Redlands in California. Our second speaker will be Dylan Simon. Dylan joined the Every Life Foundation as the Newborn Screening Policy Fellow in September of 2019. Prior to that, he interned for the Senate Help Committee and worked at advocacy organizations. He began at Research America, where he advocated for increased support of policies that would allow for faster biomedical progress. After that time, he moved to Veterans Against Alzheimer's, where he worked to help launch the network, which focuses on improving treatment and caregiving for veterans who suffer from Alzheimer's. Dylan holds his master's degree in molecular biology and immunology from the University of Maryland, Baltimore, and he has his bachelor's degree in biochemistry from Case Western Reserve University. And then our final speaker is Kylie Barber. So Kylie is originally from Arizona, where she earned her bachelor's degree in human development and family studies with a certificate in child life from Arizona State University. She then went on to earn her master's degree in child development from the Erickson Institute, as well as a master's degree in children's law and policy from the Loyola University Chicago School of Law. Many of you may know her as our current medical foods policy associate at the National PKU Alliance. She's been in this position for almost 2.5 years. And so this is a partnership that the NPKUA has with the Every Life Foundation. And so Kylie works tirelessly, full-time, 5 days a week, 8+ hours a day, advocating for our PKU community. And her primary responsibility in that work is the passage of the Medical Nutrition Equity Act, which would ensure coverage for all adults and children with PKU living in the United States. So I'm so excited that we have some great speakers tonight, and I'm going to turn it over, please, to Eric.
Great, thanks, Christine. And I have to say, looking at that slide of all the people together at Rare Disease Week at the Reagan Center, I can't believe that was almost a year ago. It was one of the last big in-person meetings that I attended. So hopefully we'll get to do it again at some point, but great to be here in a virtual setting. So I'm Eric Gasco. I'm the Vice President of Policy and Government Affairs at the National Health Council. For those of you who aren't familiar with us, we're similar to the Every Life Foundation in that our core members are patient advocacy organizations, both rare disease groups as well as more prevalent conditions. We're also unique in that all our members include all players in the healthcare ecosystem, so including provider organizations, insurance companies, biopharmaceutical companies, really the whole spectrum of the healthcare ecosystem. And we all work together on issues that impact all people with chronic diseases and disabilities. So I'm going to give a kind of brief overview of the 117th Congress, which just started a few weeks ago, and the incoming or current Biden administration, what we know so far and what we've seen so far means in terms of where Congress and administration's priorities will lie in healthcare policy. So first things first, want to talk about, if I can get the slide to move, there we go, sorry for that. So first things first, we are looking at historically narrow margins. So as we all know, the Senate has a 50-50 tie, with the tie-breaking vote being Vice President Harris. But then also the House really narrowed in its margins in the November elections. So by and large, what this really means is bipartisan consensus will be very important to get things to move. It may also mean that we see fewer things move in this narrow of a Congress, and potentially may result in a higher level of administrative actions than we've previously seen. So I'm going to go through to show kind of who is in which position at this point. Don't need to memorize all this. I won't talk about all of it, but I will share these slides later. And one thing to say for those of you who see your senators or your members of Congress on here, it's important to know that they have pretty outsized power when it comes to moving legislation. So always good to have those folks in these positions. So looking at the Senate, the big change here obviously is that everything has flipped. So now former minority leader, now majority leader, is Chuck Schumer, and vice versa. We'll see Senator McConnell is now the minority leader. So not a whole lot of changes as we look at many at the top here. We see on the minority, again, Mitch McConnell is now the minority leader. John Thune has moved from majority whip to minority whip. Looking at the committees as those are being put together, we see a lot of similarities as what we had seen in the previous Congress, a couple probably meaningful changes as it relates to the issues that we care about is that now the leading Republican on the Senate Finance Committee, which has jurisdiction over Medicare, will be Mike Crapo from Idaho, as opposed to Chuck Grassley from Iowa. And he has a little bit different of approach when it comes to particularly issues around drug pricing. And so we're keeping an eye on kind of how some of those conversations will go forward. Similarly, we also see a change on the Health, Education, and Labor and Pensions Committee on the Republican side, with Richard Burr taking on the top slot for Republicans on that committee. He has a long track record in many healthcare issues, and so it'll be interesting to kind of see how some of their priorities may shift with that change there. Moving to the House side, I don't see a lot of changes, particularly at the top, as the House remained in Democratic control. I will say a couple of things to keep an eye on in the future as you see some new blood coming into leadership. So folks like Hakeem Jeffries from New York, I like to call him the original Mayor Pete from Redlands, California. Mentioned earlier, I went to the University of Redlands, so did Pete Aguilar. So I'm happy to see a Bulldog in that position as he's quickly working his way up the ranks in the Democratic caucus. On the Republican side, again, I see very few changes here. Kevin McCarthy, my former congressman, continues to hold on to the leader position, and Steve Scalise is still the whip. So looking at the committees, this is where we see quite a few changes, as there were a number of retirements at the end of the last Congress. I will note a couple areas here. One, Kathy McMorris Rogers now becomes the ranking member on the Energy and Commerce Committee. And Brett Guthrie is now the ranking member on the Health Subcommittee. So I know we've worked with him on a number of issues, and interesting to see him take over for Congressman Burgess in that position. Also want to highlight that the new chairwoman of the Appropriations Committee is Rosa DeLauro. Many of you probably know the chair with the purple hair, as she's known. is a long time advocate and champion for appropriations for the National Institutes of Health. So we were very pleased to see her end up with the gavel in the Appropriations Committee. She truly sees the value of NIH appropriations. So moving on to the administration, we start to see some of these slots be filled out. I'll highlight a couple folks that will be very important to get to know very quickly. First and foremost, Javier Becerra, the Attorney General of California, has been appointed and designated as the HHS Secretary. Vivek Murthy, who we knew from the Obama administration as Surgeon General, has been designated to return in that role. Both of those are subject to Senate confirmation. Also want to note some of the agency heads. Janet Woodcock, who runs the Center for Drugs, has been placed as acting commissioner. And you may have seen that the Every Life Foundation put out support of that, and she is in the running for the permanent job. And she's a longtime friend and champion of patient engagement and drug development. So happy to see her in that position. I'm still waiting to see on the CMS administrator. That's been a very tightly held secret. So it'll be interesting to see who they end up putting there as well. So what does this all mean in terms of policy issues? I want to kind of start with where we left off last year in the end of year package. Just want to highlight a couple things that were pretty meaningful for the folks that we represent and care about. So the end of year package was next round of COVID relief, as well as full year appropriations to fund the government through the end of the fiscal year. A couple key highlights that maybe have not been gotten as much attention in the news. One is that they extended availability of telehealth services through the end of the year and made permanent many of the mental health telehealth services. So as we've all seen, as we're doing these meetings on Zoom now, and a lot of people have been getting their healthcare through telehealth services, really have seen a lot more buy-in from providers, from payers, and certainly know that from what we've heard, many of the people who have utilized these services have largely found them beneficial. But we, of course, want to see any permanent move there towards telehealth be done in an equitable way that really improves care. Also, we saw a lot of funding go towards COVID relief and pandemic response. A lot went towards supply chain to vaccine administration and distribution. There was a bundle of money put in to study long-term impacts of COVID, which from the chronic disease community we think is very important. I will say that one of the things that the second the ink was dry on that bill, I think there was a recognition that more needs to be done, and that'll be one of the first priorities of this Congress and of the Biden administration. One of the things driving that is, I want to add one more thing too, is that we also saw surprise medical billing legislation included in that as well, something that the patient community really fought for the last few years, and we're happy to see a compromise finally be reached and legislation passed in that area. So one of the things driving the need to focus on COVID relief quickly is that there are some upcoming deadlines that will be driving much of the congressional debate. The unemployment benefits will expire in the middle of March. The small business relief, eviction and foreclosure moratoriums, will expire at the end of March. And so these are really what will be the deadlines that are driving Congress to get the next round of stimulus and pandemic response relief done in the first quarter. So I want to highlight a couple things that the White House has put out in terms of their priorities for COVID relief. Really a big focus on vaccine distribution. I think we can all agree that the faster we can get vaccines distributed, the happier we will all be as we can get through this pandemic. I know that's going to be a big focus in really rolling out vaccines in a faster and more equitable way. Also see an emphasis on more funding for testing, funding for SAMHSA for mental health support, expansion of the public health workforce, and subsidization of COBRA coverage to really ensure that people can continue to be insured as they're losing employer-sponsored coverage. So one of the things I want to highlight is that much of what was also included in the Biden plan may not have bipartisan support. So right now the goal is to move that with a 60 vote threshold by getting a Republican buy-in. But they have said that there will be an opportunity to go through what's called budget reconciliation, which I'll explain at a very high level in a second. But there will be things that the current Congress administration will look to do that may or may not have bipartisan support. So we'll see not only COVID legislation, but they have ambitious plans for things like drug pricing legislation, looking at redoing the Medicare Part D program, and potentially even pushing for a public option. So you probably have heard the term reconciliation. I will explain it very briefly at a very high level. There will not be a quiz on this, but really want to highlight three main things. And you may remember reconciliation around the ACA repeal and replace fight. The three main things here: one, it only requires 51 votes. So if every Democrat voted for it and Vice President Harris was the tie-breaking vote, it would pass. Whereas most legislation requires 60 votes in the Senate. It must be directly related to the budget. So there are these things called Byrd rules that the Senate parliamentarian will determine whether or not it fits within the scope of a budget reconciliation. And most importantly, for a lot of things we care about, it cannot increase the deficit. So anything that they do through this budget maneuver has to be paid for. And many of those offsets may come from things like tax increases, from drug pricing legislation. So there will be a lot of conversations about how they're actually going to pay for a lot of these things. Also notably, they can only do one per year. So in this Congress, they'll be allowed to do 3 of them for some really weird reason that not everyone really understands, but they'll be able to do 3 over the course of 2 years. And so they'll be trying to roll some pretty big packages, not just on healthcare, but potentially things like energy, environment, education, things like that as well. So with all of that said, knowing that we have, again, very historically tight margins with seemingly potentially not a lot of appetite to have bipartisan negotiation, we will likely see a lot of administrative actions on priorities of the administration. So some of these things, and we did see executive orders come out today on the ACA and on Medicaid. So they'll be looking to do things through regulation, largely overturning things that have been done over the last 4 years, and then potentially reforms to the drug pricing system through regulation if they're not able to do them through legislation as well. So we have seen a few executive actions already in the little over a week that the Biden administration has been in place. We saw some in the first few days that really focused in on health equity and equity generally, which is something that we, the National Health Council, are very excited about and very much support efforts towards driving better health care for all Americans. They put out a memorandum that said that any regulations that the administration puts forward will have considerations of things such as how it improves public health and safety, economic growth, social welfare, racial justice, environmental stewardship, human dignity, equity, and the interest of future generations. So really kind of putting out what are the priorities of the administration on any single executive action that they may take. We saw a number of ones related to health equity as well, on an equitable pandemic response, on advancing racial equity and support for underserved communities. And in this one, they created a task force to look at these issues. and then one on preventing discrimination on the basis of gender identity and sexual orientation. So again, really setting high-level expectations for what this administration plans on pursuing within healthcare, but then more broadly on the Biden agenda. And then last but not least, fresh off the presses today, President Biden signed a few executive orders focused in on the Affordable Care Act, opening up a new open enrollment period for the next few months to really help ensure that people are able to get insurance during the pandemic. And then also directing the government to roll back some of the changes we saw over the last 4 years. And they're very high level, but from what we understand, are really geared towards things such as subpar health insurance, what's called the family glitch to really increase affordability for people who can't afford employer-sponsored coverage because they have purchased a family plan. And then last but not least, looking at some of the changes that have been made to Medicaid, such as work requirements, and looking to undo those as well. So I believe that was my last slide. So again, thank you all. I know there was a lot in these slides. Happy to have them shared with the attendees. I know there's a lot of good information in there that I wasn't able to get to, but certainly appreciate you all being here this evening. And I will turn it over to Dylan.
Great. Thank you, Eric, for such a wonderful presentation. So I'm here to talk to you today about the Newborn Screening Saves Lives Reauthorization Act. So before I do that, I want to make sure my slides are working first. Hold on one moment, please. There we go. So I want to provide a little bit of background on newborn screening and kind of why this piece of legislation is so important. And so newborn screening is a vital public health program because it is able to test all babies in the first days of life across the entire country. And so it is one of the most successful public health programs because it is such an equitable program. In fact, that everybody is screened. Everybody goes through a newborn screening panel. And so approximately 1 in about 178 newborns have a condition that can be detected through screening. And through the screening, you can get the early diagnosis that is so important to so many rare diseases. And that, as you're all well aware, that early diagnosis allows for early treatment, and early treatment when individuals are asymptomatic really ensures that they're getting the treatment when it can really make a difference. And not only saving lives, we also know that early detection can save money to the overall healthcare system because it tends to avoid costs for unnecessary costs from an untimely diagnosis. But I think it's really important to stress how newborn screening is more than a test. So often when discussing newborn screening, you hear about the heel prick, that the actual test itself are associated with newborn screening, but it is more than that. It is a system. It is education materials for parents. It is training for newborn screening healthcare professionals. It is a sample collection, the testing, but it's also follow-up services, ensuring the fact that when a baby is identified through newborn screening, that the state public health lab can get all the way back in touch with that family to make sure they come in for confirmation testing. And that is obviously such an important part of newborn screening. And lastly, quality insurance. Most of the testing is using these wonderful machines, but we got to make sure that they're working properly. And so really ensuring the fact that the testing is doing what it's supposed to do. And so it's important to remember, especially when we talk about some of the provisions later, that newborn screening is a system. It is not just a test. And so a little bit of background on some of the federal newborn screening policy. And so there's the federal RUSP, or Recommended Uniform Screening Panel. Is a list of disorders that the Secretary of HHS recommends for states to screen as a part of their newborn screening programs. It's important to remember that the key word in that is recommended. Newborn screening is a state-run program. While there are federal aspects to it, which we'll discuss in more depth on this during this presentation, it's important to remember that the states have the final say. The states are the ones who are doing the testing. They're the ones who are doing the follow-up services. They're the ones who are making the final decision on which disorders are on their newborn screening panel. And currently there are 35 core conditions to a RUSP. And that can change as conditions are nominated for the RUSP. As we speak, there's actually one nomination package currently being reviewed by the advisory committee. And we'll get to the advisory committee in a little bit. But a little bit of background on terms of the Newborn Screening Saves Lives Authorization Act. So back in 2008, Congress passed the original Newborn Screening Saves Lives Act, which established a national newborn screening guidelines and helped to facilitate the comprehensive newborn screening in every state. It's important to know that prior to the initial Newborn Screening Act in 2008, the number and quality of newborn screening tests varied greatly state to state. In 2007, only 10 states required infants to be screened for all of the recommended disorders at that time, which is approximately 29. And so the intent behind the Newborn Screening Saves Lives Act was to really provide an overarching theme, an overarching recommendation on how states should be running the newborn screening program. So you didn't have what is called death by zip code. Essentially what death by zip code is that you could have a baby born in one state, be screened for condition, be identified to have that condition, begin receiving treatment, and then in another state, that's a similar baby is not screened for that condition, and therefore they don't begin the life-saving treatment that they can have access to. And so that's really the heart of the federal program, is to really try to eliminate as much as you can that death by zip code, where whether or not you get identified with a condition depends on which state you live in. And so the authorization for the federal program expired as of 2019. And so we'll talk a little bit as to why later on, but it's important to note that all these programs expired as of 2019. And that is because of what was occurring in the Senate. And so the Senate Health Committee did not hold a markup of this bill. And this is because Senator Rand Paul was pushing for amendment to the bill that required parents to opt in to allow for their newborns' unidentified dry blood spots to be used for research purposes. And the reason that this is such an issue is because this will require informed consent. And while we recognize the importance of informed consent, the issue with the amendment is that it will require it to be implemented immediately. And we're well aware that that will create such a huge burden on the system, and hospitals will not be able to immediately begin that process. And if they were not able to immediately begin that process, they would essentially shut down the ability to use these dried blood spots for newborn screening research. And that shutting down would result in long-term implications in the research, and would really delay the ability for new conditions to be added to the RUS and new treatments to be developed. And so it was really, the biggest issue was that informed consent aspect. And so you can see here, there was issues where, and more than 70% of the research published around dry blood spots use these samples to develop new tools and treatments. And so it wasn't just quality assurance, it was to develop these new treatments. In addition, the government had essentially already discussed this issue, how informed consent for research use of dry blood spots was a significant challenge, but because they were de-identified biospecimens, it was allowed to continue without informed consent. And so while we recognize where Senator Paul was coming from, we believe that the amendment didn't fully appreciate the short-term harm that this amendment would cause. And so that really kind of stalled out the amendment in last session. And so that kind of brings us to our current status. And so I know I said that the programs remain expired. However, certain actions have been taken to ensure that the federal newborn screening program is still running at the status quo level from 2019. And so the Advisory Committee for Hereditary Disorders in Newborns and Children, this is a committee that oversees the RUS that we talked about earlier, was reopened in March 28th of 2020. And Secretary Ayers at the time used his authority to establish the Advisory Committee as a discretionary committee, which has a 2-year authorization. And this was really important because this reopened the ability for the Advisory Committee to review RUS nomination packages. And so, as I said before, there's currently a package under review that got delayed half a year to 9 months because the Advisory Committee wasn't open and wasn't taking RUS nomination packages. And so it was really important that this Advisory Committee to get reopened. In addition, we did see funding for both the CDC program, which oversees the quality assurance, as well as HRSA's program, which oversees grants to states in FY20 funding. And so while we did see funding, it's important to note that this maintained the status quo. But the idea behind the reauthorization was that the status quo wasn't good enough. We wanted to see improvements to the federal newborn screening program. And so while we are thankful that the advisory committee was reopened and the funding continued for these programs, we wanted to see the newborn screening program move forward. And so that's why we're still fighting to get the reauthorization passed in this session. And so I wanted to use this slide to really discuss kind of the key bill provisions within the legislation. And so first, it reauthorizes the HRSA grants that help to expand and improve screening programs within states, help to educate parents and healthcare providers, as well as improve the follow-up for infants with detected conditions. And so these HRSA grants are vital for the state programs to ensure that they can run their newborn screening programs. And so the reauthorization and expansion of them was a key part of the provision. And one of the ways that it expanded was to help to re-engage patients who did not receive recommended follow-up appointments. So too often there's times in which a baby is identified through newborn screening and they are unable to bring the individual back in for confirmation testing. And so part of this reauthorization was to help to identify ways to really start to decrease that occurrence. In addition, it reauthorized the advisory committee. An important part of that reauthorization was it directed the advisory committee to make the RUS nomination process more transparent. And so when putting together a RUS nomination package, it is always led by patient advocacy organizations. And there's always a need to make it more and more transparent. It is a very long process to put together the package, and it tends to be opaque in terms of what exactly is being reviewed and how it is being reviewed. And so this direction to make it more transparent would really benefit the patient advocacy organizations. In addition, it did reauthorize the CDC, which is fantastic, and it also directed the National Academy of Medicine to conduct a study how to modernize newborn screening program. And that's really important because, as we discussed, the federal newborn screening program is still relatively young. Originally passed in 2008, this is still a relatively young federal program, and this was a great time to really look back and look forward simultaneously, to look back at what has worked in the newborn screening program and look forward. As we know, more and more patient advocacy organizations are pursuing newborn screening as a diagnostic option. We are well aware that newborn screening is a huge growth in the next 5, 10, 15 years, and really look at the system and see, can it withstand that? And if not, how can we improve to ensure that every condition that is right for newborn screening can have access to newborn screening? And so some next steps, a key part, which we're really excited about, is on January 25th, the original sponsors from last session reintroduced the bill into the House, which was fantastic. They actually brought along an additional 20 original co-sponsors, many of which were co-sponsors on last session's bill. And that's a fantastic start. It's always great to see your champions really hit the ground running with a new session and introducing legislation. And so something that you can do right now is really to contact your representatives and highlight the importance of this legislation and ask them to join as a co-sponsor. It's always fantastic to continue to grow co-sponsors on a piece of legislation to really highlight the impact and the importance of this piece of legislation. In addition, I know I talked a bunch about the Senate. The Senate is planning to introduce their version of the bill in the coming months, and having high conversations with them. They are hoping to do it sooner rather than later. They definitely recognize the importance of passing this legislation now, due to the fact that the authorization has been lapsed since 2019, and so they definitely want to move quickly. In addition, we want to work with the Health Committee to determine an equitable compromise if needed. So this goes back to Senator Paul's amendment. As I discussed, because we do have the status quo and there is the funding in place for HRSA and CDC, we do recognize that the program is running and that we want to ensure the fact that we are not compromising on the amendment just to get the bill passed. And so we're really excited about this opportunity. We're really excited for the new session and think we have a really great chance to get the reauthorization finally passed this year. So thank you so much and look forward to your questions. And I'm going to pass it over to Kylie, who's going to talk about the Medical Nutrition Equity Act.
Awesome. Thank you, Dylan. And thank you, Eric. Man, you two are a tough act to follow. I will say that much. I learned so much, and I know a lot of our advocates are so appreciative of the information that you guys presented. So we appreciate it. Let's make sure I have control. of these slides. All right, it looks like we have success, you guys. So again, I'm Kylie Barber. I am the Medical Foods Policy Associate at the National PKU Alliance in partnership with the Every Life Foundation. I know I've met a ton of you in person through Rare Disease Week, as well as, phone calls and emails, and I see a lot of new names on this webinar tonight, and I'm very, very excited about that, and I'm excited to get to know you guys, and hopefully this year be in person, advocating on behalf of the Medical Nutrition Equity Act. So let's get into it. So just as a quick reminder, what is the Medical Nutrition Equity Act? It is for you PKUers. This is the bill that we have been hoping and praying for gosh, at least the last 9 years. So just as a quick reminder, the Medical Nutrition Equity Act is a bill to provide for the coverage of medically necessary food, which you guys know all about, and vitamins and individual amino acids for digestive and inherited metabolic disorders under both federal health programs as well as private health insurance. Let's see, go back. Perfect. Okay, so let's talk about the Medical Nutrition Equity Act in the last session of Congress. We are stoked about the way that it ended. We left a strong footprint on Congress. In the House of Representatives, we had 77 co-sponsors. 66 of those were Democrats, 11 of those were Republicans. And of those co-sponsors, 68 have maintained their seats and will be returning or have returned to Congress in this session. On the Senate side, we ended with 8 co-sponsors, which 6 of those were Democrats and 2 of those were Republicans. And again, we are thrilled about these numbers. In the House side, we nearly tripled the amount of co-sponsors from last Congress on the House bill. And we actually are pretty proud of our traction that we were able to make in the Senate, albeit, not necessarily a large number, but the traction we did make sets us up for this year. Okay, so thinking about a pathway forward in 2021. So again, all of our lead sponsors, both in the House and the Senate, have agreed to be our champions once again during the session of Congress. As a reminder, in the House side, it is Representative McGovern from Massachusetts and Jamie Herrera Butler from Washington State. And on the Senate side, it'll be Senator Bob Casey from from Pennsylvania, and Senator Ernst from Iowa. So what is the current status of this bill? So our plan is to reintroduce the House and Senate bills early in 2021, as earliest as we can. As soon as they are reintroduced, we are going to ask advocates to contact their senators and representatives to request their support. Our goal is to build support for the bills quickly, so we are asking advocates to stand by and stay alert, ready to reach out to your members of Congress and senators once the bill drops. While we do not have a specific timeline at the moment, this issue remains top priority for both Representative McGovern in the House as well as Senator Casey in the Senate, and I know that they are actively working on making sure that this bill comes to fruition as quickly as possible. I most recently spoke with a staffer from Representative McGovern's office, and she noted that they are actively doing negotiations on the language for the bill, and we should have some sense of finalized language within the next couple of weeks. So that is very, very good news as far as the legislative process goes. Okay. So upcoming advocacy opportunities for the Medical Nutrition Equity Act. The Rare Disease Legislative Advocates Rare Across America 2021 is coming right up, and I know a lot of you have already signed up and registered for this event. It looks like we have just under 30 advocates wanting to participate in this. So it's a very exciting opportunity to advocate for the Medical Nutrition Equity Act. This is a great opportunity to prime your representatives and senators for the reintroduction. And the best part is, advocates, you guys can just do it from home. We've made it pretty accessible for everyone. So prior to your meetings, advocates can find updated talking points and a one-pager on the mpkua.org website under Take Action, and then go to Medical Nutrition Equity Act tab, and then there will be a link there that you can print off a one-pager and have that ready and prepped for your meetings. The most urgent priority is asking those members of Congress who were on the bill last Congress to be an original co-sponsor of the new bill this Congress. Another priority is to continue to ask those members of Congress who did not sign on, maybe they had some reservations about the bill, or we just never really got around to talking to their office. We want to ask them to be a new co-sponsor of the bill once it's introduced. While we don't have a specific timeline for the bill, it is important to continue to raise the issue with Congress, encouraging them to be on the lookout for when it is reintroduced. And third, some of our advocates will have the opportunity to meet with brand new members of Congress who are new to office and who may have not heard of the issue before. This is, again, an excellent opportunity to develop your relationship with your new member or senator and ensure that they are educated on the issue. We also want to encourage advocates to utilize the Rare Across America training webinars that the RDLA provides. They help prep you for your meetings, are really thorough, and are all free to advocates. So I highly recommend using that resource. Lastly, if you haven't done so, we are asking advocates to submit their medical food story at nutritionequity.org. Nutritionequity.org is the website of the Patients and Providers for Medical Nutrition Equity Coalition. These stories are critical to building support for the bills in Congress. So we please ask, yourselves, your children to share their story, because these are the stories that really resonate with your members of Congress and really grab their attention and help them understand how urgent the issue truly is. And I think that is all that I have for you guys. And then now I think it's the advocates' time to shine and ask us questions, anything that's come to mind throughout the presentations.
All right, I'm going to go through the questions. So if you have questions, please type them in the chat or the Q&A section in the bubble of the webinar. So we have, there's a list of, an ask for a list of current co-sponsors, which somebody did share a direct URL on that list. So check that out. What is the reason for negotiation on the language of the MNEA?
So that's a really good question. So we don't anticipate a big change in the language. I know that there are several groups who are interested in medical foods, right? PKU obviously is one of many who rely on medical foods. And so I think that they are trying to make it more amiable for maybe a larger group of people. But then that does, that presents a challenge because members are more hesitant to sign on. The bigger, the more conditions that are added on makes it more expensive, which sort of prohibits Congress members from wanting to push it through. So we are trying to negotiate, make it as inclusive as possible, but also making sure that, it definitely serves the PKU community. Again, we don't anticipate a ton of changes, but there could be, some nuances here and there. One of the biggest things that we noticed from this past legislation, this past Congress, was that there was a line that mentioned to include the primary conditions on the recommended uniform screening panel of the newborn screening. And we also want to make sure that the secondary conditions are in there as well. So that is one definite edit that will be in the language.
Do we know who are the critical members of Congress to appeal to?
Yep, again, good question. So it depends on which committee the bill is referred to. In the past, it's been Ways and Means, Energy and Commerce, and oh gosh, and Rules, I believe. There was also Armed Services as well, although this, we already got TRICARE passed, so we can, kind of, it won't be referred to Armed Services, if that makes sense. And also, as we go through the grassroots advocacy process, depending on where the legislation is in the legislative process, sort of dictates or determines where our advocacy actions are going to be focused. But for sure, the committees of jurisdiction.
Thank you, Kylie. I don't see any other questions in the chat yet, so please feel free to type away, ask these great speakers all you can while we have them here with us tonight. Here's one. I've just requested a meeting with our senator after the bill is passed by the House. About how long will it be before it's brought before Senate?
So that's a good question. We're trying to get them introduced at the same time. The language should be exact same. So we could be advocating both in the House and the Senate at the exact same time. I mean, in the ideal situation, they would be both going through that process at the same time.
I believe I heard Dylan's staff legislative committee in the past. When the MNEA is marked up for hearing, how does he suggest we best communicate with committee staffers to educate them about the MNEA? What information will be important to provide?
So I guess first I would defer to Kylie in terms of, do any of your lead co-sponsors sit on the committees of jurisdiction? And
so they don't. Do you mind reading the question one more time? I was looking at the chat trying to catch up on that question.
Sure. And if you guys want to click on the question and answer area, it might be helpful to read it. I believe I heard Dylan's staff, I'm not
Okay.
sure, a legislative committee in the past. When the MNEA is marked up for hearing, how does he suggest we best communicate with committee staffers to educate them about the MNEA? What information will be important to provide? Okay,
yep, yeah, got it. That's a good question. So they were referring to, Dylan, when you were interning at the HELP committee.
I'm just curious, on the House and Senate side, do any of your 4 lead sponsors sit on the committee that will handle the markup?
They don't.
Okay. So that'll change everything a little bit. So that means you're probably going to want to do your best to contact somebody who's on the committee, which is harder but doable. But really what you want to do is try to advocate to staffers of committee members because they're the ones who are going to be in the markup and advocating for the passage of the bill. And when advocating to those committee members, it's no different than advocating to any representative and their staff. Right? It's the same idea of, you want to tell your story, you want to talk about the impact, the positive impact of this piece of legislation and why it's so important to so many people's lives. And so it's really more, when talking about a markup, it doesn't necessarily change how you're telling your story. It's more a question of ensuring the fact that you're talking to the right people, to ensure the fact that they are the ones who are actually be in the markup. So that's, I guess, would be my comment to them. Eric and Kylie have also been doing this a while, so I'd welcome their input on this also.
Yeah, no, that was excellent, Dylan. I would say, just for advocates, again, keep an eye on the messaging that MPKUA puts out for action alerts and things like that. When it comes time, we will be targeting those constituents, those advocates who are constituents of the members of the committees of jurisdiction. And the best way to do that, I mean, I can join you on meetings. We can email directly their staffers and make sure that the message is clearly communicated and that they understand the urgency of the issue.
Yeah, and I would say first and foremost, co-sponsors. Not only does co-sponsorship help show that there's interest from members of a committee or of Congress, but also gets people on the record to know who your friends are. So even if the lead champions are not on the committees of jurisdiction, if you do have a number of co-sponsors on there as they go through a markup, you know who your friends are, and those are the ones who you should be prioritizing as you talk to your colleagues who may have them as their member of Congress to reach out to them.
Okay. And you may have answered this already, saying that there'll be information that will be shared. Any specific talking points for new senators and representatives?
That's a really good question. So here the priority is just going to be educating them about the issue and also developing a personal relationship with them, because if they know you, they know your issue, they have empathy towards that, and they're more likely to sign on, they're more likely to do what you ask. Again, we will have talking points posted up on the website that you can print off and familiarize yourself with. But I think, you know, again, educating this office about the issue and telling them your personal story, trying to appeal to their emotions is going to be big there.
If I haven't signed up for Rare Disease Week, can I still sign up?
So let me ask, is it Rare Disease Week or Rare Across America that they're curious about? Rare Disease Week, yep.
The event coming up.
Okay, so yep, so Rare Across America. There's a lot of rare, I know, it's confusing. So, and usually, typically Rare Disease Week is held about this time, as Eric, you know, made reference to at the beginning of the webinar. But because of COVID, we flopped them. So Rare Disease Week is actually gonna be in the summer. I believe it's July. Dylan, correct me if I'm wrong.
It is in July.
Okay, great. And then for Rare Across America, again, that's going to be held end of February, beginning of March. Registration is closed, but if you are interested and a last minute registration, shoot me an email and I'll see what we can do, if we can get you guys signed up.
All my reps and senators are the same as last year. They all agreed to join as co-author and they didn't. How best to approach them this year?
I think that that is exactly the way that you should approach them. I mean, obviously using tact, but, you know, approaching the office with, you're familiar with this issue. It's something that you agreed to sign on. Last Congress, we just want to make sure that, you know, we can get you signed on this Congress sort of thing. Would be my approach. Also connecting me with that office as well, so I can then, you know, follow up with that office after you talk to them can help too.
The other comment I'll make about that is it's important to remember in a situation like that where when not joining as a co-sponsor, it doesn't necessarily mean opposition to the bill, it can be neutrality. And that's also not a great thing. You want them to be an ally, you want them to be a co-sponsor. So I'm not saying neutrality is a good thing. I'm just saying don't assume that it's opposition. And so when having the conversation with your congressman.
Yeah, that's a great point. And friendliness is key, you guys. I know I mean, you guys know better than I do as far as the frustration and sort of, you know, banging your head against this wall. But the best way is, you know, approaching these offices with urgency, but also friendliness.
And I would say, you know, it may not even indicate neutrality. I mean, last year, as we all know, was a very, very weird year for so many reasons. And, you know, all the Hill staff were drinking from a fire hose with so many different priorities last year and having to do it from home and learning to work in new ways. So it's always worth that follow-up, reminding them that they agreed to do it. And they may have new staff now too that you may have to educate as well. So don't forget that there's often a lot of turnover with the new Congress.
What does subsidized COBRA entail? Where can I find out more?
Sure. So I'm gonna have to look this up because I always get the acronym wrong, but the Consolidated Omnibus Budget Reconciliation Act is what COBRA stands for. Many of you have potentially used COBRA in the past. It's a way to continue your employer-sponsored coverage when you leave a job or when you lose your employment, which, as we know, a whole heck of a lot of people did last year. If you have used it in the past, the one thing that you'll know is it is incredibly expensive to maintain your employer-sponsored coverage through the program. And so one of the things that we've been pushing for, and we've seen this in the past during economic downturns with lots of layoffs, and is that the federal government can agree to step in and help pay for a big chunk of that premium. And it's really important to be considering this for one really major reason, and that's that Yes, you do have an opportunity to purchase through the ACA marketplaces when you lose your job, and now there'll be a new open enrollment period opening up. But we do think that for people who have underlying conditions, particularly expensive conditions where they may have already hit their deductible or hit their maximum out-of-pocket cap for the year, it may actually be more financially advantageous to stay in your plan through the end of the year and then start over the following year in an ACA plan. So our approach on advocacy has been more ACA open enrollment, subsidized COBRA, just giving all those options because everyone's going to have a different circumstances they'll be in. So hasn't been subsidized yet. We know that this is a priority of the Biden administration. We know that Republicans have been supportive in the past. So we're hopeful that we'll see that included in the next round.
When does an experienced lobbying firm add value in this process, since we have the alignment of Democratic Congress and White House this session and not guaranteed for the next session?
No, I'm not sure if this is sort of a specific question on any of the two bills that have been mentioned or just kind of more of a general question. I can answer from a general perspective, and then if we want to have the other two kind of dive in more specifically. I think it's helpful. You want to strike while the iron's hot. If you think that you have a advantageous political setup that is not guaranteed for the next Congress. I will say, having worked with lobbying firms in the past, I think there are pros and cons that come from that. Certainly, you want to make sure that patient organization and patient advocates are front and center as the representatives of the condition on the Hill. But certainly lobbying firms do get you access. They have relationships that you may not have. And they can absolutely help with a lot of the back of house strategizing as well. So I think there's certainly a lot of advantages, but I would say just really ensure that, particularly if they can cost a little bit of money, that you're kind of leveraging that expertise in ways that are most helpful for your cause.
The MNEA specifically is now noted, so I don't know if there's anything to add.
I think Eric said it quite succinctly and thoroughly.
Okay, great. Thank you. These two kind of are in the same area, and it might be for Eric. What are the committees of jurisdiction that we need to know? Are they the ones that you reviewed earlier, Eric?
Mostly, yes. In the House, Energy and Commerce and Ways and Means are most important, have most of the health jurisdiction. There's also some that relates to education and labor committees. It relates to large employer coverage. If you have concerns with veterans programs and the military, certainly those committees also are important. On the Senate side, Finance has jurisdiction over Medicare, and Health, Education, Labor, and Pensions has jurisdiction over most other health issues. And then similarly also, wait, nope, never mind. Education and labor built right in there. So it's a little bit different in the House. So those will be the two. And then certainly if you're focusing on appropriations, the appropriations committees as well.
Okay, because this next question was also relative to it. Besides the committee members from committees of jurisdiction, should we also focus on members in leadership positions as well in House and Senate? Please note that Richard Neal and Catherine Clark, both from Massachusetts, have co-sponsored in the past, as well as the chair with the purple hair from Connecticut, as well as others. So anything to add to that?
Yep, there's a lot of great people. Richard Neal is also the chairman of the Ways and Means Committee. Catherine Clark is in leadership. I think it's always helpful, particularly folks who may have the ear of Speaker Pelosi. And I think when you look at the Senate, it's also very, very important in the Senate because so much of the floor is controlled by the majority leader. So really, having that buy-in and also remember, without 60 votes, any one member can hold up legislation. So sometimes it may not be the people that you think of. We heard of the senator from Kentucky who often will hold things up as well. So don't just think of don't just have those conversations with the people that you know are your friends. You may have to have the conversations with folks who may be people that you might consider to be opposition as well. So always consider who those people are, find ways to kind of get them onto your side, or at least to Dylan's point, get them to a neutral, is something that you always need to consider as well.
Yeah, and then
Go ahead.
sorry, I just want to clarify something I said before. In terms of working with members who are on the committee of jurisdiction, that's very specific to just when talking about the markup. And to echo Kylie and Eric's point, the more co-sponsors is better, and if co-sponsors are in leadership, it's even better. And so you always want to bring as many people onto your side as possible. And so getting somebody like Congressman Neal or Congresswoman Clark on as a co-sponsor is only going to be a good thing.
Okay, do we have time for a couple more questions? It's 8 o'clock, but I'll take a couple
Let's
more.
take one more, and then we want to respect people's time.
Yeah, absolutely. And somebody is looking for a website for talking points. If you want to just put that in the chat quick, Dylan, if you have
I
that.
can do that.
For the newborn screening bill?
Yep.
We can answer that. Is there an expected legislation upcoming that MNEA can be tacked onto for ease of passage?
That's a really good question. I know a lot of the the big legislation this year is going to be related to the COVID relief packages. Certainly there's going to be a healthcare package as well. Eric or Dylan, you might know more than I do on that one.
There's always a vehicle. It's really getting to the folks who are making the decision on what gets tacked on. Certainly COVID, there will be at least one, if not multiple ones. Probably some sort of ACA relief and stabilization moving this Congress as well. I will say one of the things that a lot of our members have found helpful last year is if you can find ways to kind of use COVID as a way to highlight the problem that you're trying to solve. That certainly, and there's absolutely a connection there with the MNEA. What are those ways that you can say, this will really help from people who are struggling through the COVID pandemic? And then similarly, I know the administration and the Congress are really planning on focusing in on health equity. So the more that you can frame that as an equity issue, I think will also be helpful, particularly if it's something that kind of cross cuts across COVID and equity, I think will be really helpful.
Okay. Well, thank you all for joining us this evening with this presentation, and thank you all to our speakers. We will have this on a recording that will be up on our website soon. Our websites are listed right now on this last slide. Have a great evening, everyone.